A lot of dentists think that sleep apnea treatment could be a cool add-on to their practice. But what if I could tell you that treating sleep apnea in your practice could add $500,000 a year in annual revenue? And while doing this, you can build your brand, save lives, and make a major impact on your community. That's what happened to me in my office, so let's talk about it. From the first day that I opened my practice, I knew I wanted to treat patients with sleep apnea. I didn't want it to just be a cool add-on. I wanted it to be a pillar of our practice as we focused on treating the oral systemic connection. Fast forward, we now do over $500,000 in annual revenue on sleep apnea treatment alone, and we usually receive 15 to 30 referrals per month from physicians in our local community. On the flip side, I've talked to many of my colleagues who have tried to implement sleep apnea treatment into their practice to really find it to be frustrating and, to be honest, an expensive hobby. Let's get into the system on how we made this a profitable procedure in our office while making it also a good reputation builder as we started to save lives in our community. So let's walk through what I would consider the 4 pillars of making sleep apnea treatment in your office both effective and profitable. Step 1 is you have to become the expert. You do this by building relationships in your medical community. By reaching out to physicians with sleep medicine, ear, nose, and throat, primary care, and connecting with them in a professional relationship, you will start to build your brand as being the expert on sleep apnea treatment and dentistry in your community. Let me give you the line that I would use when I was reaching out to physicians in my town. Hey, Dr. Smith, my name is Dr. Chaz. I'm a general dentist, and I have a practice that focuses on oral systemic health. One of the main pillars of this is airway health. We screen every patient for the potential of a sleep-related breathing problem, and I want to work with you to refer patients as well as help you whenever it's appropriate to treat people in our community that are suffering from sleep apnea. Can we grab a coffee sometime and talk about the potential of working together collaboratively? By instilling this sort of collaborative approach, you build your brand, you build yourself as the expert in your community, and you will start to gain referrals from these physicians. The second step is to get elite training. I'm never going to encourage letting the how stop you from pursuing your passion, but it is important to feel confident and prepared so that you can treat people effectively. There is the American Academy of Dental Sleep Medicine in the Mastery Tract. There's Spencer Study Club, and there's other study clubs through COIS and SPEAR that you can take to become an expert in treating patients for sleep apnea, as well as screening for potential airway problems. Get the training you need, get the credentials that will give you authority with physicians who are going to be referring to you, and feel confident in treating the patients that you're going to be seeing. The third step in treating sleep apnea in your office effectively is outsourcing your medical billing. This is where most dentists fail. The truth is, medical billing is not dental billing. And I'm going to let you in on a little secret. The physicians that are going to refer to your office for sleep apnea treatment really care deeply about whether you take medical insurance or not, and whether it's affordable to their patients or not. So, you don't want to be an amateur in this field. You want to go pro. By utilizing companies such as Pristine Medical, Nearman, Dental Sleep Solutions, or any other company out there that does specifically dental sleep medicine, you are going to look like a pro. You're going to get great feedback from your patients that are going to be coming back to their physicians, telling them that you are an expert and you helped them walk through the medical billing process. Don't be like most dentists thinking that you can just dabble in this. Spend the money, invest in a company that's going to make you look like a pro, and do your medical insurance billing properly. The fourth and final pillar to effectively treating sleep apnea in your practice is to dedicate a team. We have a dedicated assistant and a dedicated administrator that strictly do sleep apnea treatment in our office. They don't dabble between dental and medical. By doing this, we were able to scale quickly. They quickly became experts in their field, and they felt very comfortable treating the patients that we were seeing. My last piece of advice to you, if you really want to treat sleep apnea in your practice and make it a pillar of what you do day in and day out, dedicate a team before you have all the referrals coming in. Use them to build referral streams, to build systems and processes, and you'll see your practice quickly take off, and you'll become reputable in your town for treating sleep apnea effectively. If you're passionate about treating your patients effectively, saving lives, and building a strong reputation in your community, then sleep apnea treatment is the perfect path to do that. But don't tiptoe in, go all in. Build your team, dedicate them to the process, outsource your medical billing, connect with your medical community to build referral streams. When you do this, it's not the fast path, but it's the steady path that will get you exactly where you want to go. If you want to know more about treating sleep apnea effectively in your practice, stay tuned. It's a passion of mine, it's a pillar of my practice, and we're going to be diving into that more and more on the channel as we go along.